What are veneers? Do I need them? Do veneers damage your teeth? Do I get veneers before or after braces? What's a peg lateral? Can I fix a peg lateral with veneers? We'll cover all of that and more, plus one of my patient cases on today's episode of Braces Explained. Let's go. Alright, welcome back to another episode of Braces Explained. I'm Dr. Greg and I hope you guys have all been having an awesome week. If you haven't had a chance yet, I made an ebook as a thank you for all of you subscribers on here, which I'm going to link out in the description of this video. It's basically on my website, asatrianortho.com/ebook. So be sure to snatch your copy of that. Also, if you haven't had a chance to check out our new Facebook group, the Braces Club, I'll go ahead and put a link to that in the description of this video, so go ahead and check that out. So today's video is going to be about veneers and when they're sequenced in your orthodontic treatment. And I have to give a huge shout out to my buddy Dr. Sammy Shahal, who gave me the idea for this video. He's a cosmetic dentist and he is huge on YouTube and social media. He's actually my inspiration for getting started on this channel. So if you want to see some of his work, I'm going to put a link out into this corner. You should definitely check his stuff out. Alright, so let's get into it. Let's start off with the most basic question of today's video, and that is, what are veneers? So veneers are basically a porcelain or a porcelain-like material that are attached to your tooth, and they're kind of like a jacket for your tooth. They can change the shape, they can change the size, and they can also change the color of your teeth. They're meant to last a really long time. I wouldn't say a lifetime because sometimes they do chip, but they're meant to last a long period of time compared to, let's say, like a filling for your front teeth. More often than not, veneers are cosmetic, but a lot of times in certain cases, which I'm going to talk about a little bit later in this video called peg lateral cases, I definitely recommend veneers because what it does is if there's a tooth that's a little bit too small or a tooth that's a little bit chipped or stained, it can make it so that it matches your other teeth so that it doesn't stick out and look different and kind of catch the attention of someone's eye. So this brings us to the question, do I need veneers? Who needs veneers? So to answer that, it's a little bit complicated. I definitely have this conversation with my orthodontist and general dentist, but I definitely would have an orthodontist as part of this conversation. The reason I'm saying this is because a lot of people might want to get veneers and say, you know what, I don't need any orthodontics, I just want to reshape my teeth. But the orthodontist could put the teeth in the ideal position so that the roots are parallel as well as the gum structure is in the ideal position so that when you get these veneers you really get a phenomenal result as opposed to just getting veneers if, let's say, your teeth are crooked. Also, more often than not, if you are to get veneers prior to orthodontic treatment, they might have to use the drill and take off excessive tooth structure, whereas if your orthodontist was to put the teeth in a more ideal position, it would minimize the amount of tooth structure that would have to be removed in order to make the optimal size and shape for these teeth. So this brings me to a question that a lot of people have been asking, and that is, can veneers be used to treat peg laterals? And to answer that, I kind of have to explain what peg laterals are. I'm going to chime in here and just say, if you're enjoying this video, be sure to give it a thumbs up and hit the subscribe button so you can stay up to date with all of these videos. Okay, back to the content. So what peg laterals are is that they're the lateral incisors, so not the front two teeth, which are your central incisors, but the ones just lateral to them, these, which are the lateral incisors. They sometimes come in variable sizes, shapes, and sometimes they're even missing. So when you have a peg lateral, it's basically that these lateral incisors are shaped like pegs. They're smaller and they're conical in shape, so they don't look ideal in their size. So I'm going to show you a little bit of a preview right now, and we're going to talk about it more a little bit in this video, but I have a patient whose picture I'm going to put right here. And this is an example of what peg laterals look like. And this photo is taken at the end of his orthodontic treatment. And you might be saying, wow, there's still gaps everywhere. Yes, I agree with you, but these lateral incisors, which are the two teeth that are just outside right here of your two front teeth, they have a really big tendency of being different in size and shape. So they're very variable in their shape and size and even presence. So what I usually recommend for my patients that have peg laterals is, you know what, let's get the back teeth in a good position so we have a solid bite, the front two teeth in their ideal position, and we'll leave space for these peg laterals on both sides so that your general dentist can put veneers on these teeth. So let me show you guys a case of one of my patients that had peg laterals and how I set his case up so that he could be ready for veneers. So this is the case I showed you guys earlier, but before we delve into this one, I want to show you another one to prove a point. So in a previous video, I've shown to you guys what a good bite looks like. And what a good bite entails is that your upper canine should fit between your lower canine and premolar, and this is called class 1. And you want this to occur on both sides. And if this is to occur and your teeth are all the right shape, you'll have an appropriate overbite and overjet with your midlines on. Now let's go back and look at that previous case. Our goals were achieved. We got our class 1 canine on the patient's left side as well as the patient's right side, and in good overbite and overjet. But since the upper teeth were small, they were peg laterals, this is where we put them. You see, there's a ratio in orthodontics where we calculate the width of the upper 6 teeth and the width of the lower 6 teeth. If this ratio is perfect, then we'll have what we saw in the previous case. We'll have a good class 1 bite and a good overbite, overjet with the midlines on. But what you see in this case is that with that ratio, we have an excessive amount on the lower compared to the top, since the upper teeth are smaller. And this is what we call a Bolton discrepancy. If we were to just close up all this space, what you would see is that, yes, he would still have class 1 canine, but if we were to close all this space up, if you imagine if I was to just power chain this all closed, we would put him in an underbite, which is not ideal. So what we did is we set up his bite just like this, and we referred him to a cosmetic dentist to have veneers placed on these 2 peg laterals. So this is what he looks like now after he got his veneers done. It's a lot more harmonious and it looks really good while still maintaining a proper bite and overjet. And this is the type of results you can get by using veneers. In his case, we only had to use 2 for his peg laterals, but sometimes a dentist will recommend, let's say, all of the top teeth that are visible in the aesthetic zone, so maybe 6 or 8 teeth. And this way all the teeth will be made to their appropriate shape, size, and color so that it'll look textbook perfect. So this raises the question now, should I get these veneers before or after I get started with my orthodontic treatment? And the answer is you should definitely get it done after. Because let's say you have peg laterals and your dentist just fills them to the size that he or she thinks is appropriate for your current bite. Now, as we align all the teeth, we realize maybe these laterals weren't built up enough, or they were made to be too big. Then we're either stuck with having an excessive overjet and overbite, not enough overjet or overbite, or a bad bite in the back. So definitely you should be having your orthodontist take a look first so that your teeth can be put in the proper position, so that when you get these veneers done for your peg laterals, or veneers done for any teeth, they're put in the position that is most harmonious and balanced position, so you have the most ideal result. One last thing you should do for sure before you get veneers is, if you're interested in having your teeth whitened, you should have them whitened before the veneers. And the reason I'm saying this is, when you get the veneers made, the dentist that makes these veneers is going to want to make your veneers match the rest of your teeth. Now, veneers are made out of porcelain, so they don't change their color over time. So let's say you get these veneers put on, right? And you go and you say, you know what, I want to whiten my teeth. Now, every tooth in your mouth will be whitened except those veneers. So what's going to happen is you're going to have these beautifully white teeth and these veneers that were matched to your yellowish teeth, and it's going to look off and you're going to have to redo the veneer. So definitely get your orthodontic treatment done first, have your teeth whitened so that they're the level that you are most happy with, and then get the veneers done. The veneer should be the last step in your process. So now that everything is all said and done, you might be asking, well, how do I maintain and care for these veneers? Well, veneers should be taken care of just like every other tooth in your mouth. I'm going to put a link in the description of this video with all the hygiene products that I recommend. Whether you're in braces or not in braces, these are the products that you should use, as well as check out my videos on how to maintain proper hygiene. You should still be brushing your teeth as well as flossing around these veneers to maintain the gum structure around them, as well as make sure that there's no cavities that form along their margins. So I'm going to ask you guys, do you guys have peg laterals? If you didn't even know that peg laterals existed, let me know in the comments of this video. If you enjoyed today's video, make sure to give it a thumbs up and hit the subscribe button so you can stay up to date with all things braces. Also, be sure to join our Facebook group, the Braces Club, so that we can have some conversations between me and other people in braces, so you can kind of have a community that can help answer your questions, and so that your questions don't get just knocked down like they kind of do in the comments section here on YouTube. On that note, I hope you guys enjoyed this video, and I will see you guys next time on Braces Explained. For now, Dr. Greg, out.